Welcome, everybody, to Western Center's training. What should we do when state and federal policies are shredding California's safety net? I hope you arrived ready to save the safety net, or at least be with us for the next hour or so to brainstorm some ways to fill the critical gaps that have been made by attacks on our precious safety net over the past several years. So that's what we're going to do today. First, a little bit about Western Center, in case you don't know us yet. We are a anti-poverty nonprofit organization, and we fight in the courts, cities, and counties, and in our state capital to secure housing, healthcare, and public benefits. We advocate through the lens of economic and racial justice for a strong social safety net for low-income Californians. And the presenters today are myself. Hi, I'm David Kane, an attorney. I specialize in healthcare.
Hi, I'm Jodie Berger, and I'm an attorney at Western Center, and I specialize in the social services benefits. Thank you.
So before we dive in, just some Zoom tips. You can turn on closed captioning by clicking Show Captions on the Zoom toolbar. If you have any questions, please put them into the Q&A function in Zoom. We will try to use that at the end of our portion, toward the end of the webinar, to answer as many questions as possible. Please use the chat for any comments or technical issues, or to share resources, or when we ask you to put things into chat. And if you have any accessibility needs or encounter any tech barriers, please let the host know via the chat. And we are being recorded.
Okay, we are going to launch a poll to see who is here today. So I just launched it. You should be able to see that on your screens. And go ahead and fill that out. We're going to hold it open for another 20, 30 seconds. Okay, they're starting to taper off. So I'm going to end the poll. Mostly summer interns, but we've got a good number of experienced attorneys, paralegals, advocates, and then other forms of people. So here are the results. Okay, thank you. So I'm going to launch the next poll because we would like to know what. Now, why is that not opening? We would like to know if you work for a legal services provider, and if you could identify your organization. For attorneys, if you could add your BARD number, and for everybody, if you could please give your email address. Attorneys, at the end of the training, we will have a QR code and a link for you to be able to get your MCLE certificate. So I'm just waiting for people to put that in. They were kind of dribbling in. And I'll leave the poll open until we get to about 80% or so. We're halfway there. Okay, let's see if we could get a little bit more. We're almost at 3/4. All right, and it seems to have stopped. So I'm going to go ahead and, got one more. I'm going to go ahead and end the poll. And here are the results. So a little bit more than half of you work for a qualified legal services provider, or if we include the unsure, that's about 3/4 of you. So thank you, everybody. So I'm going to turn next to our training goals. As you could see here, we're going to understand, hope that by the end of this training, all of you understand what is the safety net and what is shredding it, identify successful or unsuccessful strategies to resist federal actions, apply strategies to defend and repair the California safety net, and consider questions about designing a better safety net. So please do stay on to the end. We're going to have a fun interactive session where you could dream your dream and make the best safety net for our residents. Next slide, please. So why do we have a safety net? Why do we need a safety net? California's overall safety net is 17.7%. That is based on a non-official poverty measurement. It's called the supplemental poverty measurement. That includes regional variations, includes the receipt of benefits, but also has expenses that are really volatile, such as housing and childcare. California, those two areas are amongst the highest in the nation or the highest in the nation. And so it's important that we factor that in. When you look at the poverty rate specifically, it's currently 18.6%, which is nearly triple the level we were at during COVID. It had gone down to 7.5% in 2021. That's the lowest ever in California since they've been measuring these things. And it was specifically because of the various supports that were put in place to respond to the pandemic. As you could see, the older Californians make up 20%, and that's the highest chunk of people who are impoverished. And there are race and ethnic disparities that's consistent with most social services programs and most poverty programs. They are just building in a lot of stereotypes and historic discrimination. Next slide, please. In addition to the racial disparities, there's also regional disparities. And we could show you quickly here. San Mateo is 6.5%. That's a very high income county. It's adjacent to Santa Clara, the high-tech county. LA, which has the largest probably of everything in the country in terms of social services. They're always the largest caseload. They're in the middle at 13.6. And Modoc County, which is a little tiny county way up north, 20% of the residents are impoverished. Just noting the Bay Area has been seeing significant increases in poverty, and currently it's a third. It's really high. 34% of Californians are poor or near poor. So for us having the fifth largest economy in the world, we also have incredibly high poverty. So the safety net is particularly important for us. Next slide, please.
Yeah, so I mean, that 34% is about 13 million people in California. And so we want to talk now a bit, what is California's safety net that strives to make sure that those 13 million people or more have what they need to live here? And we first wanted to ask you, when you think about California's social safety net, what do you think is in it? What programs are there to support people who are living in poverty in California? So if you can, put those in the chat. We want to hear your thoughts on what you think is in California's social safety net.
CalWORKs, good, Gilberto. Disaster relief funding. Thank you, Tina. And hi.
Hey, Tina. Hi. Yeah, we don't often think about what happens after a disaster and how it amplifies the need for a social safety net.
General assistance, good catch. I believe that's Rashida. CalWORKs, CalFresh, Medi-Cal, housing vouchers, Section 8. Symmetri's been doing some work in this area, I think. Legal aid organizations, interesting.
Yeah.
Good call. Food stamps, Medi-Cal. Yeah.
Good. Sounds like we are among like-minded people, and understanding the social safety net is for people with low incomes when they need something. And that's why we need a safety net. Ooh, libraries.
Libraries. Yes. That's where a lot of people access computers now.
Yeah, keep this going, because it'll help us at the end of our webinar when we start to brainstorm what the next safety net is. When we think about the safety net, and as we talk about it, and thank you for that, in this webinar, we're mostly focusing on these sorts of programs that are run by the government, federal programs and state-only programs. We're not going to go through them all right now because there's too many, but you can see them here on this slide. They include many income support programs, cash assistance, healthcare, loans, other childcare, education. That's what we think about when we think about California's social safety net. We also think about how when we're thinking about making sure that we're addressing the shredding of our safety net and rebuilding it in a way that works well. How right now and for almost all time, the safety net has not adequately met the needs of people who need a safety net. And so our friends at the California Budget and Policy Center looked at some data from 22 to 24 and found that major safety net programs here like CalWORKs, CalFresh, the Earned Income Tax Credit, the Young Child Tax Credit, the Federal Earned Income Tax Credit, and Cash SSI and SSP reach only half or way less than half of Californians who need this safety net. You'll see Medi-Cal there is above meeting the group of people that need healthcare in California. And that's because Medi-Cal's income limits for children are largely above this 200% FPL cutoff that we have for the people who are needing the safety net on this slide. We also look to figuring out what's in the safety net and how we should think about this. We looked to other organizations. So we did a quick scan and saw that some of our partner organizations define it much like we do, and we are doing in this webinar. Lots of public benefits programs run by the government, through the tax system, through county social service agencies. Other visions and descriptions of what the social safety net are broader and include values, which is just as important, such as EPIC and child poverty in California, a compassionate, dynamic, and durable system providing stability needed to weather difficult and unpredictable situations, adapted to individual and collective needs. At Western Center, something we like to add to the definition of the safety net is that everybody's basic needs are met. Food, clean air and water, healthcare, housing are accessible in the languages that people need them. Policies, programs, and systems are accessible to everyone and benefit everyone. Everybody's basic needs are met. Everybody can pursue their goals. So just some things to think about as we envision what the safety net is and what it should be. Jodie, back to you.
Sorry?
Back to you.
Yeah, okay.
I put it myself on speaker, but then I didn't have a microphone. So hopefully it does not crap out all the way. My apologies, everybody. So what is shredding California safety net? A little bit of everything, right? Federally and state, there's legislation and budget. There's also federal executive branch, including the Department of, I'm going to currently put in quotes, justice, and the state legislation and budget and state executive branch. Next slide, please. People have been hearing HR 1, which is last year's federal budget. The federal government likes to say one big beautiful bill. We do not. We will call it HR 1 in this presentation. Imposed a huge hit on federal safety net. It had a lot of changes in it, but the ones that David and I deal with most is the work requirements that were imposed on Medicaid for the first time nationwide, but it expanded the program that had been in place federally for the food, the SNAP food program, which is CalFresh in California. California basically had not had that rule applied except for a handful of counties for a year and a half because we have high unemployment. We qualified to not participate in that program. It was waived. We currently only have 6 counties that are waived, and we reinstituted the work rules last month. They also imposed for the first time ever a co-payment if you go over a certain number of payment errors. This is just for the SNAP or CalFresh program. It used to be that if you were below the national average on errors, you were left alone. If you were tied or above, you may have to do a corrective action plan, and eventually there could be more severe consequences. Everybody now is subject to a certain percentage of errors that will be tolerated is 6%. And anything above that, the states have to co-pay for the benefits. They have never, ever, ever asked the states to pay for benefits. By the time the law went into effect and people knew what was needed because of automation and some other factors, California couldn't turn the ship, the ocean liner midstream. We were sort of locked into having this, but we're facing a $2 billion copayment because of that change, which is a big shred to the safety net. That's $2 billion that is not available to help people in California. In addition, for the first time ever, they changed the split of administrative cost. It used to be 50-50, and now the state has to pay 75%. Under our state law, that rolls down to the counties. So the counties will have to cough up more money as well. And there is a question of how they will be able to do that. The short answer is some of them will be protected and some of them won't. But just from the work rules, I'll do CalFresh, David will do Medi-Cal. They think that 660,000 people are at risk of losing benefits because of the expanded and currently in effect work rules. It's work or other activities. But that's how many people who are at risk. And David, what's happening with Medi-Cal?
Yeah, this is the worst. Anywhere between 1 and 3 million people to no longer have access to healthcare by 2030 in California.
Okay. There's some proposed federal legislation, just flagging real quickly, two of them. There's the Preventing Waste, Fraud, and Abuse Act under TANF. The bad parts of it is increased tracking and reporting. Again, they're saying that is because of fraud. They're not distinguishing between fraud and mistakes. These are systems that are the participants report and they're human, and the workers handle information and they're human, and using passive voice mistakes happen. They have nothing to do with fraud, which is intentional. And aligned with other priorities, this bill would take tracking and reporting down to lower levels and be more extensive than currently exists. So it also would have a chilling effect. And they're to do all of this with no increased funding since 1996. That has already been an issue for California and some other states who have chosen to try to help people under that family cash aid program instead of imposing short lifetime time limits and very strict rules and making people go into dead-end jobs. And so states that are more helpful in their safety net are penalized by having to contribute more state funding because the federal funding is static. There's also been a visible increase in traffic about child-only cases. TANF is a family aid program, and a child-only case is one in which there are no adults who are aided. And the federal government is targeting California in specific, but they're probably going to do something national where if the reason there is no adult is because of their immigration status, that the children would not be eligible for aid either, which would, thank you, birthright case, means that everybody who is a U.S. citizen in a mixed status household could possibly not be getting the family aid. Again, California has the largest caseload in the country. If something like that goes through, it would have an enormous impact on our safety net because so much would need to be switched. It depends on how they define the immigration status. And then the last one is government shutdowns. You probably know the end of every September, Congress has to pass by the end of September, Congress has to pass a new budget, and otherwise anything that is not a mandatory program will shut down. There's certain things that are protected, mostly Social Security and Medicare, I think. But a lot of stuff gets shut down. We've all lived through this now because they're happening more and more. And so there has been, and we'll talk about it more later, litigation to address the government shutdowns. Next slide. Executive orders and agency actions. There have been 489 executive orders, double what happened under the prior Trump administration, which was the former high. In fact, it's more than double. I think there was 220 the first time. There is a lawfare tracker that helps you see what has been challenged in court, and an executive action watch that lets you track the executive and agency action. So that's a broader set of things other than the lawfare tracker. I mentioned a little bit before, but more specifically, there's data grabs and intrusions to expand what data could be collected for federal programs. There have been federal subpoenas to try to get information from state and localities. And David, you want to talk about what they've done with Medicaid and ICE?
Everything they can to try to scare people by going after their private Medi-Cal case information from the government and from medical providers.
And then an example of proposed litigation regulations is the TANF Privacy Act. Those comments are due on the 23rd. And that is a regulatory action in response to the agency tried to get this information through executive order. It was shut down by litigation because they didn't have permission to do this. And now they're trying to go through the correct procedure, which is to notify the public that they intend to collect a lot more data. That data is down at the individual level, and it can be shared with other agencies. That in theory is any agency, but the one they're really interested in obviously is Department of Homeland Security. If it tracks what happened with the SNAP data collection, that would also lead to litigation on whether or not they could do this and whether or not it's necessary. The states already have enormous restrictions on who they could serve and how, and what kind of data keeping they have to keep to show that they're correctly administering the funds. So this is getting to the individual level is unnecessary. It's main thing. There's also a proposal to change how federal grants are administered. It is a very scary proposal right now. A lot of this is transparent. And what this proposal would include is that when you apply for a grant, some person, any person along the line who picks up one of these grant applications could say, oh, I don't think this group or this proposal is within administrative priorities, and they could just toss it, be summarily denied in a pre-public setting. And then within what are issued, the guidance for whether or not a federal grant would be issued is administrative priorities. So that will blow in the wind as the administrations change. Previously there was sort of an agreement that you should have a more neutral process that was stable and consistent and could be relied on. And this proposal will also allow the federal government to end grants at any point at their own determination that it is no longer consistent. And that's regardless of the reliance on the grant in terms of spending and contract commitments. So big hit there. Next slide, please. David, did you want to do this one?
Sure. We just wanted to make sure that it was abundantly clear that when the federal administration is attacking our social safety net in California, they really are focusing on immigrants in particular. And they've issued several rules and actions to restrict access to health clinics, Head Start, homelessness, and more. Fortunately, that's blocked by the courts right now. They've also issued new immigration rules, including one today on public charge, designed to make sure that immigrants don't stay enrolled in public benefits that they are entitled to be enrolled in and that they should be enrolled in under program rules. There's also an awful proposed rule out of the Federal Housing Department about mixed status households, mixed immigration status, and that's what the graphic is on this slide. It will make it impossible for mixed status households with people who have immigration statuses that don't qualify for housing assistance for that family to live together in federally funded housing in the future. And above and beyond all of that, and while this is all happening, the ICE kidnappings on the streets, adjacent to many places where people need to access their social safety net services and benefits.
Right. Excuse me, going back to the defunding fraud, waste, and abuse lies, there was an attempt to go after blue states. They originally thought they were going after more states, and then they very clearly went after blue states to freeze the TANF family cash aid and the federal child care programs. There was a preliminary injunction granted, and I just am calling this out because the wonderful quote from the judge that issued the preliminary injunction, defendants do not even provide one concrete detail about the fraud investigations or an example of misuse funds in their letters to the plaintiffs. So they were not able to freeze those funds. There actually was a slight delay, at least in childcare, but those are frozen currently.
Yeah, and we wanted to just debunk this fraud, waste, and abuse lie when it comes to Medi-Cal in California. This attack on the social safety net has got no supporting evidence behind it. Yet the federal government has gone and withheld more than $1 billion from our state for the Medi-Cal program. The truth of this is that when the federal government and the state governments investigate fraud in any kind of Medi-Cal or Medicaid program, they find that fraud in the parties that get money from the program. People who have Medi-Cal do not get money from the program. They get health care. So it is often the healthcare providers that are the ones committing the fraud because that is where the incentive is to get large sums of money. The Georgetown Center for Children and Families put together an excellent analysis that we took a quote from on this slide that explains just how fraud is not a problem and not any reason to attack Medi-Cal eligibility.
Maureen, continue, David.
Sure. Yeah, so state legislation also shredding our safety net in California. This is our governor and state legislative officials making budget decisions that are gutting the Medi-Cal program, oftentimes echoing and amplifying the anti-immigrant sentiments and actions of the federal government. For example, our state government has blocked enrollment in the Medi-Cal program for immigrants who are largely undocumented and a few other statuses. That is expected to result in 1.3 million Californians not having health care in the future. Also, starting next year, the state has decided that they're going to deny people who are immigrants the benefits of Medi-Cal health plans. Like everybody else gets, only immigrants will not be able to get those. In July of next year, they're going to cut dental care and also make only immigrants pay for their Medi-Cal in monthly premiums. For everybody on the Medi-Cal program, they are also lowering the asset limits so people can't save the money they need when they're in crisis in California. And they're refusing to compensate for the attacks by the federal government. In fact, in the Medi-Cal program, the state has decided to amplify HR 1's cuts to the Medi-Cal program by applying them to state-funded immigrants. They're not required to do this, but they're doing it anyways.
There's also been a refusal to fully backfill, almost entirely refusal to backfill for the HR 1 cuts to the CalFresh program. I will mention a little bit later which ones they did decide to contribute to. There's been for a while now a hostility in the state legislature for tenant protections because of the landlord-funded lobbying of the legislatures as well as legislators who are landlords. So there's inadequate funding for affordable housing programs, which are under further attack from the federal government. But within the state, there have also been lack of funding to create a good safety net for our people in the state who are challenged by the high cost of housings or who are unsheltered. And there's been a historical resistance to new revenue streams, i.e. taxes. California was out there in the 70s with Prop 13. That was the real big hit that California took on the ability to raise additional revenue through properties, and it has continued. And most recently, Governor Newsom was responding to statements from, we also have the highest number of billionaires in the nation who live in California. And some of them said, I'm going to move. I don't like the politics of this state. And there are rumblings, and we'll talk more about that later, about a billionaire tax. And Governor Newsom announced that he does not want the billionaires to leave the state. And so he is not favoring any revenue enhancements. They were not part of his budget proposal. And said they're going to go to ballot. So next slide, please.
Yeah, so on to what is California doing to protect the safety net, given this onslaught of attacks and thoughts? So fortunately, through the state budget and legislation process, there have been efforts to protect the safety net, including some on this slide. Specific bills to protect Medi-Cal eligibility for people, specific state budget funding asks to do the same, including for immigrants that are being cut under H.R. 1, as well as funding to support access to healthcare for transgender youth, when providers are cutting that off, and other aspects of the state budget and legislation, which are highlighted in our webinar that was on June 25th. So we encourage you to go to that one for more information.
Mm-hmm. And that last bullet on increased funding for CalFresh outreach, that's specific to CalFresh and then county workers generally, that was in the final budget. So that was one of the successes that advocates pushed for that. And that was the backfill that has gotten through about HR 1.
We also think about efforts to protect our safety net not coming just from the state government, because they make decisions to cut the safety net because they have to pass a balanced budget every year. One thing that's happening is counties and cities are looking at how can they generate revenue to backfill cuts that are happening. And so we wanted to highlight a few. One in LA County, Measure ER passed just this year, a sales tax increase to support the safety net, mostly healthcare in LA County. But in Contra Costa County, they tried something very similar and it didn't pass. Santa Clara County was the first to do this back in 2025. And so they've got a county sales tax to support their safety net. And in this year's final state budget, the legislature and the government agreed to explore a way next year to tax corporations whose employees are Medi-Cal members, to make those corporations pay for part of Medi-Cal. The details are to be worked out next year. There are a series of property real estate taxes, the biggest one being in LA, the city, Measure ULA back in 2022, that taxes property sales and transactions over a certain limit. And that revenue is used to provide vital housing development money, tenant assistance money, and legal aid money to make sure tenants have access to counsel. So that's another way that a local jurisdiction is trying to fund the safety net. Then if you are fortunate to be in San Francisco City and County, they established a $400 million reserve last year, specifically to fill in gaps in the safety net, which they used with a private funder when SNAP and CalFresh was interrupted during the government shutdown. One thing we want to highlight is pay attention to these counties, the ones that are passing these. These are some of the major high wealth counties in our state. So we have to keep in mind what's going on in some of the less wealthy counties, and how are they going to ever raise the amount of money they need to backfill what are big cuts in state and federal programs. We also look to litigation as one thing to fight back against the cuts to the safety net. Best example of that right now, our California Attorney General filing all kinds of cases challenging federal cuts. We have also been working at the Western Center to challenge these, including a case to challenge that 75-country visa ban that discourages use of public benefits by immigrants. We've also worked to challenge efforts to get medical records when the federal government tried to do that from a hospital and succeeded. And there are other efforts to make sure litigation gets in the way of these attacks.
Yeah, so one of them is I'd mentioned the data grabs and collection of additional data. When the federal government tried to do that with the SNAP program, there were some nonprofits and I think private firm was also involved that immediately filed suit. They got an injunction for not following the Privacy Act requirements on giving notice. There was also an aspect of that, which is when they did open for notice, the day after the notice comment period closed, they announced what the final rule was. And so they threw in there that this was a sham and they had not really considered comment. So that litigation is ongoing. So it hasn't been expanded yet. And then there was litigation around the shutdown with SNAP. And there'll be a case study about that suit from last year that will be in next Thursday's webinar with Western Center if you'd like to know about that. But Western Center had filed several times trying to get a ruling that CalFresh in California or SNAP in the nation is a mandatory payment program that is not subject to these annual battles over discretionary funding. And it kept being mooted out by the fact that these continuing resolutions would occur that would keep the funding going. So we kept going off calendar on our injunction hearing. And then the final budget would pass. So last year, the litigation was centering around the government's refusal to use contingency funds that were available. And that did get ordered released. They were partial funds, not full funding. And wound up that the budget then got passed. And so again, we did not proceed forward, but we are there for people. We were the only group that was suing on behalf of beneficiaries and for the principle that you cannot subject food benefits to these annual fights. The other two entities that brought suits were just over the contingency fund. And so it was a short-term perspective. We were defending the actual safety net in full.
Great. Yeah, so what are we going to do when the safety net is attacked? Where can we do our part? First, we want to take a deep breath because we got to remember that this is nothing new and we've survived. Programs have survived. We've been here before. These are some of them on this slide. In the Great Recession, major state budget cuts to our programs that we have gotten back over many years, most. The awful Welfare Reform Act of 1996, even though that happened, our state has done things to try to fill in the gaps created by that cut to the social safety net. The Reconciliation Act of 1981 made major cuts to cash aid. And the Social Security Act of 1935 excluded agricultural and domestic workers. And that resulted in excluding many Black workers in our country. Yet, we are here today. We have our social safety net programs, and we want to protect them. And so we encourage us all to pause and plan a holistic approach to protect the safety net, extending this history and this long fight we're in to make sure that it continues to exist. The first thing we encourage is to find your people, find your community, find your partners, find your coalition. When this happens, you might find that you are meeting new people involved in new coalitions and might need to reach out to new partners to protect the safety net. That's something we've been doing at Western Center. For example, homelessness and eviction protection advocates partnered with public benefits and economic security advocates to improve the due process in CDSS Housing and Homelessness Division programs. And healthcare advocates. We've been getting together, including this morning, linking up with immigration practitioners to make sure that Medi-Cal's immigration exclusions are narrowly applied only to the correct statuses and to protect patient rights when they are in hospitals and ICE is there with them. Once you find your people, which if you have any trouble, you can contact us, remember what the safety net vision is all about. It's about approaching people as whole human beings, about remembering that under a social safety net, that means everybody thrives with the support of robust and strong public programs, and that those programs are compassionate, dynamic, and durable, and they provide stability that people need. This is from EPIC, their vision of what a social safety net is. So health, housing, and economic security for everybody. And then next, we will go through doing whatever it takes, not all at once, but whenever we can do it, keeping in mind there's no single way to protect the safety net. Instead, there are multiple strategies and tactics that we can pursue.
So turning to those multiple strategies and tactics, you've already been hearing from us a bit about how people have been responding by litigating and by legislating. So we're going to spend a little bit more time talking about administrative advocacy, equitable revenue, and what it means to go local. In terms of agency and administrative advocacy, a key part of that is strengthening the trust and relationships with friendly California agencies. We are extremely lucky. People keep reminding me, when you talk about California, it is aspirational. It is not reality in, for example, a very deep red state. But there is a lot that we are able to achieve here because we have had spent a long time developing relationships with California agencies, and at least speaking for social services, and I think David would agree, health services have a baked in process to meet with the agency, have discussions, have a forum to be heard, to raise problems, and to talk about policy development, which makes a huge difference. So Western Center does a very large amount of administrative advocacy because sometimes that is the fastest and least expensive way to get something changed to improve the safety net. So some examples are look for holes in the attacks if it's coming from the federal government, and work with the state partners to turn them into shields to keep people eligible for benefits. So for example, in 2025, the federal government served the County of Los Angeles with a subpoena, asked them to turn over a huge amount of individual level files and data about CAPI applicants and recipients. CAPI is the Cash Assistance Program for Immigrants. It is the state parallel to the SSI disability program. That's the poverty Social Security program for people who don't have sufficient work history to get full Social Security benefits. The only way you're eligible for that is if you are not eligible for the federal benefits. You have to prove that before you could get on CAPI. And the subpoena was under the guise of doing an audit of Social Security about fraudulent applications of immigrants. And I scratched my head and said, what's the nexus? You can't possibly get on CAPI until you prove that you've been denied because of your immigration status. So it is a state-funded program, nothing to do with the federal government, nothing to do with fraud. But what we were able to contribute is I worked with the attorney who was working for LA County on the response and put together a document of all the state privacy laws that governed these programs and why the state was prohibited, while the county was prohibited under state law from turning this information over, as well as discussing other aspects of the Constitution and law. And they never had to turn anything over. It just went away. I'll turn it back over to David.
Yeah, and agency advocacy, we look for where can we push to make the federal cuts as least harmful as possible. And it requires digging into the very discrete details of the policies. And that's what we're doing when it comes to Medi-Cal's work rules and requirements. Also pushing for a delay to those which the state may request from the federal government, anything and everything to try to stop them from harming as many people as possible. We also are looking for ways to turn the work rules into opportunities to provide what people really need. And I really want to credit Tyrone Hanley at the National Center for LGBTQ Rights for inspiring this great idea. What if somebody had to simply go and show that they volunteered to keep their Medi-Cal, but that volunteer program actually met their whole needs as a person in partnership with community-based organizations. So those are also things that we are exploring.
Yeah. And I would just say one of the outcomes of HR1 is California started a multi-agency workforce development process to try to give expanded opportunities to people. So not only they would meet their participation requirement, but they would get the services that they need that has not been provided in a full-fledged or holistic manner. And as another example, sort of a win-win, Los Angeles County is connecting with nonprofits and encouraging people as that one of the options to meet the work requirements is to contact a nonprofit who has agreed with LA to do what's called workfare. So you work off your grant, which could be 12 hours a month, 17 hours a month instead of 20 hours a week. And so the nonprofit gets the help they need. The person meets their work requirements, and this will also lead to connections and opportunities that maybe people didn't have access to before.
Yeah, and we also will be looking to the safety net being funded when we're talking about protecting it and rebuilding it. And here are some examples of what we want to focus on as equitable revenue solutions, because we've seen when there isn't the money, the government is forced to cut these programs. And this is based on a well-known fact that there is enough money in California to fund our safety net. The GDP in California recently reached an all-time high and is still the fourth largest economy in the world. And when you hear people talk about this, it's often talked about as creating jobs and making our state richer. That also means that there's money there to fund our safety net. And there are many ways that it can be done, including possible reform to real estate property taxes under Prop 13. There's a proposal for taxing multinational companies. There could also be higher tax brackets for high-income taxpayers. You could look at taxing services used by high-income people and corporations especially, so that it's a fair tax that doesn't penalize people with low incomes. And then we just wanted to flag to make sure everybody knew that this November, we're all voting on some propositions that will impact the ability for the state to generate revenue to fund our social safety net, including a one-time billionaire tax, revenue solutions on veterans housing, a high earner tax to fund education, and then also some public campaign financing. Jodie, were you going to cover the warning or did you want me to?
Sure, warning. Well, as David mentioned, we all hope you go to the ballots in November, vote early, vote once. And to be aware that Prop 13 is the state proposal to enact their very own SAVE Act, which is the federal act that President Trump is pushing that would require citizen checks to register to vote and to physically vote. It would require a voter ID card, and there's some other anti-tax provisions are coming up. So read your ballot carefully and know what's going to promote the safety net and what is going to infringe on it. Obviously, any attacks on voter access is an attack on the safety net. Did you want to do this one, David? Like go local.
Oh, sure. Yeah, so another thing we encourage is go local. If things are feeling overwhelming or you're not making progress at other situations and in other forums, do whatever you can do where it feels manageable. You might see what your local city is doing, what your local neighborhood council is doing, what your local community-based organizations, and especially mutual aid groups in your neighborhood or neighborhoods near where you live. All of those groups are working to protect our safety net and will be part of rebuilding it. We also encourage people to be talking to the press in order to make sure people know what's going on to our safety net and what needs to be done to rebuild it. Talking to the press is important. Jodie, did you want to add something?
No, I was just going to say mutual aid groups. An example is what was happening in Minnesota and other communities when ICE raids were making it too dangerous for immigrant families to go out in the community. People helped them meet their needs by shopping and doing some other stuff. So just an example if people wondered what that was.
Yeah, thanks. We covered the importance of voting, of course. Just as important at the local level is community education and empowerment. As these rules are changing, as the social safety net is contracting right now, people need to know how to navigate it to still access their benefits. And they need to be empowered with the information to protect their benefits. And so that should be emphasized as well. And there's lots to do there. And then finally, creation of state-funded, county-funded, and privately funded programs when federal benefits go away. This is what California tries to do largely in its budget. It's what those cities and counties are trying to do with their taxes and additional revenue. And it's what some private foundations are trying to do sometimes when they partner with government to match funds. But those might not be ultimately what saves the safety net. They can still be what we do in the meantime to make sure people have access to what they need.
So everybody's familiar with the 2025 project, which was a conservative movement we're on the next slide, to starting from the very beginning. They have a whole pipeline, but it's a plan that they actually put in writing and put into effect with the current Trump administration that is specifically targeted on taking down the safety net. The left and the progressive communities have not been so good about that. One example, next slide, is the Poor People's Campaign. It's been around probably since the 60s, but definitely by the 70s. And it is a systemic challenge, a broad-based national challenge to systemic racism, poverty, ecological devastation, the war economy, militarism. And I've not seen other people doing this. They actually have a platform about the first 100 days. That's something that presidents, when they come into a new administration, have a 100-day plan. And this is a progressive plan that includes minimum wages, updated poverty measures, guaranteed housing, and more. Next slide.
Another one that we've looked into is the Democratic Socialists of America, DSA platform. Do they have a comprehensive plan to rebuild the safety net? Well, they focus on universal health care, Medicare for all, housing for all, income supports like cash aid, and universal no-cost childcare and paid leave.
And just so people aren't too depressed, we could always strive for a gross happiness index. It started in Bhutan. The United States is ranked under a World Happiness Index. We're 23rd globally. Finland's #1, but they have no team in the World Soccer Cup. So let's turn to more about the next safety net. We have a registration link for our upcoming webinar that will touch on some of this. That's part of our summer trainings. And what we all been waiting for, what does our next safety net look like?
Yeah, so there isn't a comprehensive plan yet in California. One of the reasons why we're doing these webinars. And so we want to hear from you. If you were planning California's next safety net, what do you want it to be? What does it look like? What do you think it will take for us to get there to rebuild the safety net? So please put your thoughts, any and all of them, into the chat or raise your hand and come off mute.
And David and I could stay on because we have 5 minutes left in our allotted hours. So I'm going to go to the slide that has the MCLE and training survey on it. Thank you. If you could do the QR code or click the link, which will probably appear in your chat soon. If you are an attorney who wants MCLE credit, we need you to click that link and complete your information. So we're starting to get some thoughts about the safety net, guaranteed basic income. Thank you, Jessica.
Yeah, and our training in 2 weeks is going to feature
Oh, right.
guaranteed basic income. So please join that one. What
And
else
if you,
should be in the next safety net? Go ahead, Jody.
no, I was going to say, if you had questions, you could also put them in the chat.
Right to counsel for evictions. Good one.
Yeah, we didn't have anything in the Q&A.
Statewide right to counsel. Good. What other ideas do you have?
Better rent control. Thank you.
Yeah, thanks, Jessica. Hi, Jessica. In my neighborhood, the landlords are circulating a petition to get on the ballot new rent control and tricking people into signing that. We already have rent control. Less funding for means tested everything. That's what's happening, and that's what we have to reverse.
Or the flip side, let's fund more things that are not means tested,
Mhm.
that are based on a more holistic need than an artificial amount of whatever they consider income.
Mhm. Any other ideas?
Any other realms? Education, children.
All right. Well, please keep thinking about it. Oh, free college and daycare. The human right to housing enshrined in the state constitution. Good. Well, please keep thinking about it. Join us on July 30th. Please be in touch with me and Jody. You can contact us by phone and by email. We're going to be working on protecting and building the next safety net in California, and we want to do it with you. Anything else, Jody?
No, thank you all for attending. We hope you appreciated what we covered, and we're generating some thoughts and excitement for preserving our safety net.